Why did we choose the topic of the state of AI in precision health? Well, this really has to do with the size of the opportunity of bringing AI into life sciences, AI into health. And by that, we mean digital health, all the way from healthcare to understanding human performance, to understanding the effectiveness of therapeutics, to drug design, to how do we get people to do the right things with the right prompts. This topic is so huge. Just to give you an idea, one of the big themes of why AI in health is the whole idea of how our healthcare system works in the United States. You may see your healthcare provider once a year, maybe twice. And what happens to you in between those visits is a complete mystery. It's a basically dark zone where the provider has no idea what's going on with you. You have no idea what's going on with your own health, unless you need care and you walk into a clinic or, God forbid, a hospital. We want to change that in this new age where data is available everywhere. Devices from mobiles to wearables, etc., can collect a lot of information and bring it together. Bringing that information together and coming out with a result that says, hey, here's what I communicate to the healthcare team, here's what I communicate to the patient, and here's when I need to bring them together, is a huge opportunity. Life sciences is going to be the most impactful field of our age. This is really the golden age of life sciences, and AI as an accelerator that helps us take these possibilities and make them happen faster, better, at a bigger scale, is essentially a dream. So while this is the age of AI buzz, I think it's going to be the age of life sciences achievements. And if these can be powered by AI, this can be happening much faster and much more effectively.
Our society today is facing some of the most vexing challenges that we've ever faced before. We live in the most globalized society we've ever lived in. Economies, agriculture, geography, biology, social determinants of health, all of these factor together into what we call health and healthcare. And at the same time, technology and data are available to us to solve some of these most vexing challenges in ways that we've never been able to overcome them before. We're living in a time and age where we can leverage technology and data to forecast second-by-second changes in one's health. In the AI plus health vertical at the Institute for Experiential AI, we're working to solve some of these biggest challenges. We're taking sleep data, mobility data, vital signs data on a second-by-second basis to predict onset of delirium or cognitive decline, to predict fall risk, to predict the occurrence of adverse events in critically ill individuals. We're using natural language processing and large language models to understand the mechanisms of mental health issues and to try to forecast when an individual might be going down a bad path. We're using computer vision and pose estimation algorithms to detect abnormal movement patterns in individuals with joint disease or developmental changes. And we're using cutting-edge NLP algorithms applied to chatbot platforms so that individuals can make more informed decisions about their health. At AI plus Health, we see a bright future ahead, where all of these computational approaches, combined with subject matter experts, can inform clinical real-time decisions and long-term planning for health and wellness. We love working with industry partners, academic institutions, and healthcare provider systems to solve real-world challenges for today and for tomorrow.
We're working with the U.S. Centers for Disease Control and Prevention as a part of their Center for Forecasting and Outbreak Analytics, InsightNet, to bring actionable forecasts for respiratory illness all the way down to the hospital level. If you remember, during the COVID-19 pandemic, hospitals were overwhelmed. We had to reschedule surgeries, causing lots of pain and suffering on the part of caregivers and patients. Also, the decisions that hospitals were making were expensive in terms of actual dollars and in terms of the consequences on their ability to deliver care. This is a part of a multi-year, multi-institution grant led by Professor Alessandro Vespignani and the Network Science Institute called Epistorm. With the power of artificial intelligence, we're taking real-time data on human mobility, real-time data on cases, and operationalizing them for hospitals to predict how many people will walk through the door of a hospital on a given day and need treatment for COVID, need treatment for influenza, need treatment for RSV. These models are going to change the way that hospitals staff. They're also going to help us prepare and better respond to the next pandemic so that we can keep schools open, keep businesses open, we can save lives and livelihoods.
AI and modeling approaches in healthcare and medicine are very important for the following reason. Biology, whether it's in health or disease, is simply too complex to understand using our mental models, our intuition. I believe it can only be understood through the development of computational models. Every plane, every car, every building, every bridge today is designed on computer before it's ever constructed. We need to be taking the same approach with regard to therapies. They need to be designed on computer before constructed and evaluated in the clinic. And a good example of this is one project we have called HEART, which stands for Healthcare Enabled by AI in Real Time. In this project, we're collecting large amounts of extensive data from patients who are recovering from heart surgeries in the cardiothoracic ICU. And we're looking for patterns in that data that will signal the likelihood of whether these patients are going to do well in their recovery or whether they're going to experience serious adverse events during their recovery. And if it's the latter, our goal is to provide early warnings to caregivers that it's very likely that this patient right here is going to have a specific adverse event in the near-term future. And therefore, this enables caregivers to intervene and take steps to try and prevent that adverse event from even happening. And AI is capable of finding subtle patterns in data that signal these events, and our brains are just not attuned to doing that well.
Ethics is already an integral part of healthcare, medicine, and life sciences. With the introduction of AI into these fields, the ethical landscape becomes more complex. Traditional bioethics, medical ethics, and research ethics, while well established, do not fully address the ethical issues that arise from the development and deployment of AI in health and life sciences. AI presents new challenges, such as the potential for algorithmic bias, data privacy concerns, and accountability for decisions made using AI systems or by autonomous systems. These issues demand an extension of traditional ethical frameworks. In responsible AI, we dive into the ethically laden decisions involved in building an AI system that aligns with human values and societal goals while ensuring its use is ethically sound. For example, how do we ensure that an AI system used for diagnosing diseases treats all patients fairly, regardless of race, gender, or socioeconomic status? How do we define fairness in AI? Fairness has multiple definitions. Should fairness mean that AI treats everyone equally, regardless of their background? Or should it mean that the AI is more attuned to historically marginalized groups, ensuring it helps to close gaps in healthcare access and outcomes? And what happens when AI outpaces the ability of healthcare professionals to understand how decisions are made? How do we balance the promise of AI's efficiency and predictive power with the need to ensure that it is used in ways that allow expert knowledge and agency? So AI ethics and responsible AI frameworks allow us to integrate the answers to these questions into the development and deployment of AI systems.
Being faster than a spreading virus is our best defense against another epidemic, and AI can get us there. COVID-19 caught us unprepared and exposed to a pandemic for which we did not have mitigation strategies planned. The socioeconomic shock was massive, especially for those who were the most vulnerable. At Northeastern, we are using big data and AI to build safeguards against the recurrence of another public health crisis due to a novel or a known virus. We are pitting machines against viruses so that we can predict outbreaks, assess strategies, and monitor the efficacy of mitigation policies using AI. Imagine countless lives saved and minimal disruptions to livelihoods. That is what we are aiming for. We are simulating millions of possible scenarios of infectious disease outbreaks globally and identifying mitigation methods using explainable AI. Our concerted efforts and transformational innovations in AI will help protect us and our future generations.